Good afternoon, everyone. My name is Dr. Chip Whitney, Revolutionary Health Services, and I want to thank you for joining us on our Facebook Live session today. It is Thursday, June 4th, and tomorrow, June 5th, here in Pennsylvania, we're actually opening up to phase 2, the yellow phase of coronavirus opening up. So we're actually going to start to have life return a little bit closer to normal. So it's an exciting time for everyone, and we'd love to have normal again. And so what I've talked to you all about so far is a lot about what is the survival guide. Once we all get to start having life return to normal and opening up again, how can you keep yourself safe? So what I want to do today is I want to take the information I've been talking about so far and connect the dots. I'd like to show you why and explain to you why that the strategy you have to keeping yourself safe if you get exposed to coronavirus over the next coming weeks or months, how that same mechanism to keep yourself safe from the virus is also going to do things like prevent devastating diseases like dementia, heart attacks, strokes, and cancer. So some people have a hard time understanding, wait, how can that happen? I'm going to explain that one today. So first thing I'd like to do is encourage everyone, since this is a bit of a unique presentation I'm doing today, please feel free to share this to your Facebook friends, and if you find this information valuable. So first thing I want to quickly do is explain to you again, real briefly, if details are in previous recordings I've done, but what happens with coronavirus. So we get exposed to a virus, whether it's COVID, whether any virus is, our immune system kicks in. And our immune system works by producing inflammation. That's our word of the day, inflammation. So normally what happens is our body's immune system lays nice and quiet with minimal inflammation going on, if it's tuned up and doing well, and then we get exposed to an enemy, whether it's a viral infection like COVID, whether it's toxins like pesticides in some of the foods that we eat, or things like cancer cells. When the enemy invades our territory, our body, immune system kicks in and kills that invader through inflammation. So like when I myself had coronavirus, I got a fever, body aches, those are all signs of inflammation. If we measured my blood tests, I would have had very raging inflammatory markers that showed inflammation. So then what happens is your body fires up, it's like a fire to kill off the invader, and then it comes back down again. And so what happens with COVID is that after about 6 days to a week, people either get better like I did, or it rages out of control into a flaming brush fire of out of control inflammation, an overreactive immune system. So that's what happens with COVID. So it's exactly the same thing with every chronic disease, whether it's dementia, whether it's heart attack, strokes, whether it's cancer or other things, almost everything is based on an overactive inflamed immune response. And I want to illustrate that by talking about a case. So I have a patient, her name is Melanie, and she's a case that I've presented to many dentists. So I know there's a lot of dentists who follow me, and some of you may have heard this case, but it's a very interesting, exciting case because it was about a person who actually was significantly able to reduce her risk of cardiovascular disease through addressing inflammation and lifestyles. So basically what happened was, before we met, this woman had been found to have early cardiovascular disease and was undergoing going treatment for that. So what we do is we have a test here that we do where it's an ultrasound, where it's a high definition ultrasound probe that we do right here in our office. A special company comes in to do it. And what we do is we measure the thickness of the carotid artery. And every time human tissue is inflamed, whether it's a sprained ankle, whether it's a cut that you get that's getting inflamed to fight off, to heal the cut, or whether it's an artery that's inflamed, leading you prone to disease, it gets thick and plump. So what this test does, it actually gives a person an idea of how old their artery is, meaning they take the thickness of the artery and they tell you at what age your thickness would be average. And unfortunately, when we first did this test, she found out that her arteries were 16 years older than she was. So they were very inflamed and they were very thick. So whenever you have inflammation with chronic disease like this, you have to go in and you have to find the cause of it. You don't just treat inflammation with a pill. You find out why is the problem going on. And so when we dug into it, we found that there was a blood test, a biomarker in the blood that was elevated, that's talked a lot about at the Cleveland Clinic, which is one of the top institutions for inflammation and cardiovascular disease in the country, that basically is very specific when it's elevated for inflammation from the arteries. So what we found was hers was extremely high, and long story short, is the number one cause for that inflammation marker, again, a blood test being high, is from bacteria from the mouth, getting into the bloodstream, getting into the artery wall, and causing the inflammation in the artery wall. And the reason I present her case to all the dentists is that over the course of 4 years, this woman did not do any other variable. Everything else was doing generally pretty well from a blood sugar, blood pressure, cholesterol standpoint. There was no variable, no change in medication, no change in supplements. Lifestyles didn't change dramatically. The only thing that she did is that I was working with her dentist and she did interventions on her mouth to reduce. She had significant gum inflammation. She addressed the gum inflammation over the course of 4 years. Her arteries went from that of a woman 16 years older than she was, that it addressed the inflammation. They went to the thickness of a woman who was 4 years younger than she was. So she actually literally lost 21 years of age on her artery wall. It was really exciting to watch. And then so she could rest at night knowing that she was going to do quite well. So I took some time to unwrap it a little bit and basically showing you that we have lots of sources of chronic inflammation. So you may have heard the term chronic. Chronic means long-term inflammation. Coronavirus is an acute inflammation, meaning it hits you and it happens within a week and you get sick, you fight it, and it's over. So this is kind of the soundbite. The source of almost every chronic disease is when you have some sort of an inflammatory process that never allows your immune system to turn off. I said before that when we fight an infection like COVID, your immune system is nice and quiet. It ramps up to fight the infection, and then it settles back down again to its baseline. But when you have things like bacteria from the mouth, bacteria from the large intestine, leaky gut you may have heard of, or other sources of microorganisms get into your bloodstream, they can wherever those organisms, the body, our human body wants to get rid of those microorganisms, so it kills them through inflammation. And if there's constantly a flow of these bacteria into places like your artery wall or your brain or your organs, you never turn off that immune system, you never turn off that inflammatory response. And over the course of weeks, months, and years, it drives these chronic diseases like dementia, heart attacks and strokes, cancer, and others. So that was a lot to digest, but that's the source of chronic disease. And at Revolutionary Health Services, that's kind of the core of our wellness program, is to identify the sources of inflammation, identify where they're causing problems, like looking at the artery wall in the case of heart attack and stroke prevention, and to identify the root causes of that inflammation. So what I want to do now is I want to walk you through, well, what are the sources of inflammation? Well, as I mentioned, microorganisms, specifically coming from the mouth, coming from the intestine, other places, that's one of them. Well, another one is belly fat. Many of you have heard that maybe the fat that we have on the outside is not as much of a problem as the fat that lives on the inside. Well, what that fat does is it creates a chronic inflammation. Dr. Mike Rosen of the Cleveland Clinic talks about almost all chronic disease as source of inflammation, and one of them being belly fat because it produces insulin resistance that leads to diabetes. So as I mentioned in a previous discussion, that diabetes, prediabetes, and blood pressure aren't really the problem. The problem is the underlying inflammation causing those conditions. So belly fat is one of those conditions. So what else can cause chronic inflammation? The food we eat. A lot of the bad, highly processed inflammatory foods, they cause inflammation. I have a link to a list of those in an article I wrote on the website about your coronavirus survival guide. I send you a link to a couple links that give you resources for foods that can cause chronic inflammation. We're actually identifying things like stress can cause inflammation. So objectively, stress, we can feel that it's bad for us, but we actually now have objective ways that one of the source of problems that stress causes is inflammation. It's a source of nonstop chronic inflammation. And there's other medical conditions that are sources of inflammation too. So I mentioned that high blood pressure is caused by inflammation. So we dig into the high blood pressure. What's the root cause of? Oh, it's inflammation causing the high blood pressure. Well, one of the huge contributors to high blood pressure, that's the inflammation that causes high blood pressure, is sleep apnea. So you dig a little bit deeper into the root causes, and you find out that when you have airway problems that are blocking off your breathing at nighttime when you sleep, that the airway disease, the airway problems will cause inflammation, which causes your blood pressure to go up and actually can cause your risk of stroke to go up, and so on and so on. So again, what we do is we dig into the root causes. So certain medical conditions will produce this nonstop inflammation that kind of hammers on our organs, it hammers on our brain, it hammers on our arteries. So kind of just in review is that acute inflammation is what we're always exposed to if we have illness, whether it's the flu, coronavirus, or other infections. Our body responds by knocking it out through inflammation. So this inflammation is a good thing. But when we have these disease processes that cause ongoing, nonstop chronic inflammation, it hammers on our organs, our arteries, and our brain to drive disease. Again, infectious disease, oral bacteria, gut bacteria, molds, viruses, parasites. Lyme disease is a good example of an organism that can cause ongoing inflammation. So there's several sources that we can look at causing it. The belly fat that leads to blood sugar problems, the foods that we eat, stress, medical conditions, and others. So now we got to cut to the point of what do we do about it? And so the first question, oh gosh, I have inflammation. What do I do about it, doc? Well, you can shotgun it, do everything, or you can kind of do all those healthy lifestyles that we hear about. A lot of the things I talk about on the coronavirus survival guide, they address at settling down that chronic inflammation. So you can kind of do all the things and hope you're doing the right job, and you're extinguishing the inflammation that's non-stopping, letting you come down to that baseline to be able to have that nice tuned up immune system that kills that coronavirus when you get hit with it, and it doesn't overreact like you see with COVID. But what we do here at Revolutionary Health Services, and a lot of the root cause doctors that you hear about, is that we do an assessment to find out what is, do you have inflammation, because there are markers of inflammation. We use Cleveland Heart Labs typically and Quest and LabCorp to identify sources of inflammation. And then do you have inflammation, and then what are your root causes of inflammation if you have it, and then we can more of a targeted attack. So you don't have to just sort of do everything and hope for the best. Like, for instance, this one I was talking to you about is that people are very happy when I tell them, the most important source you have of getting rid of your inflammation is working on your gums, because that's the source. And when people hear that they can work on their gums, and maybe weight loss and exercise is important, it's a lot more easy to take care of your mouth. But bottom line, what we can do is we can do a targeted approach to helping you out and addressing your inflammation. So again, that's what we've got for today. It's a really important one. I really encourage you all, if you found this helpful in watching it, please share with your friends. They don't have to be in my neighborhood. People don't have to see me for this, but what they can do, it really helps the people get an understanding of what actually is the root cause of a lot of these diseases that we maybe have a family history of. A lot of times I find that the reason a person has a family history of certain diseases is identifiable, and we can dig deep into the root causes that run in the family and address those root causes. So I encourage everybody to start learning about this root cause approach, the system approach to health. And And that way you can just maximize your health span. That's what we do here. We try to help you maximize your health span. A long life without health is not overly pleasant. So start learning about things. One way you could do that, if you'd like, is I've got a lot of information about this on our website, rhslivewell.com, and we have the coronavirus section, but we've got a lot of patient education resources you can start digging through if you want and start learning about these things, and just really just strive to make that, whatever you are, 70th, 80th, 90th birthday, a great one. So anyway, thanks for joining us today, everybody. Again, I'm Dr. Chip Whitney, and everyone have a wonderful day.